The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, minimally invasive spine surgeon Dr. Douglas Wan talks about an innovative surgical technique he developed called Lumen microinvasive surgery. Learn more about the Texas Heart Institute and their doctors with interventional cardiologist Dr. Annie Varghese. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I would always feel uncomfortable bending over to tie my shoe. I felt like that one day I wouldn't be able to bend over to pick up my grandchildren without feeling that, and I didn't want to put myself at risk and not be here for them one day or my family. I was starting to have issues with my blood pressure. I had to have a dual-line pacemaker put in, and my health was deteriorating to the point that we needed to do something.
So he got interested in gastric bypass after his wife had it, and he's had an amazing result as well. He's lost over 100 pounds, he's off his medications, and his quality of life is just great.
I think my highest weight was like 280, and I'm now down to 161. I've came off all of my heart medications. The only thing that I take is my vitamins and my protein, and then I eat normal. I just watch what I eat, but I've come off all my medicines. I take one baby aspirin, and that's it. I was just having one problem pile on top of another one, and ever since the gastric bypass, it's been like completely opposite.
Walter's biggest medical problem was his high blood pressure. He was on a couple medications, and in spite of that, men are often much more hesitant to come in for surgery. There are equal numbers of men and women that are overweight and need the surgery, but about 80% of our patients are women. Obesity itself is a very high risk factor for premature death and morbidity. In fact, if you have a BMI over 40, it's recommended that you have the surgery without any medical problems. And so I don't want to imply that you have to have diabetes or high blood pressure or sleep apnea or high cholesterol, all these things that are improved with bariatric surgery to have it done. We've also got some literature that shows it prevents some of these medical problems like high cholesterol and diabetes and these other medical problems that we're trying to resolve.
Is your energy lacking? Though it may be the last thing you feel like doing when you're tired, exercise. Even a brisk walk can be more effective than a nap or cup of coffee at fighting fatigue.
At Lumen Health Spine Care, we developed the latest and the most innovative minimally invasive surgical technique, and it is called Lumen microinvasive surgery. This is utilizing the most modern technology so that we can preserve all the normal tissues in your spine without creating any kind of damage to your back and without stripping the muscles. We make extremely small incision and go between the muscle fibers with an endoscope to perform the same procedure as if we perform a traditional open back surgery. The big advantage is that the patients are not going to have significant amount of pain. They're not going to have their muscles stripped off their spine, so therefore it minimizes the bleeding, scarring, pain, so that they could recover so much faster. Patients after undergoing Lumen microinvasive surgery are discharged to home on the same day or the very next day, depending on the type of procedure they're having. And many of the patients can return back to work or their light duty activities pretty immediately after the surgery. So we evaluate the patient to see if they're candidate for Lumini microinvasive surgery by having a full consultation and evaluation. And patient may undergo imaging studies or pain mapping process by our interventional pain specialist so that we can clearly identify and accurately identify their pain generator, and so that we can perform the least invasive procedure for the patient. We developed Lumini microinvasive surgery because I personally witnessed it from my father, who had multiple open back surgery. He went through a significant amount of pain, developed chronic pain, and he had a failed back syndrome and lived 30 years of his life with significant amount of pain. And watching him suffer, I realized that we must do something better than what we're doing now to help all those patients with significant amount of back pain and chronic pain. So we used all the latest technology, worked closely with the engineers to develop the least invasive way to approach the spine.
Find your doctor on bestdocsnetwork.com.
Terrence has a question for Dr. Jason Harrison. How soon can I get back to work after having gallbladder surgery?
As long as you're not taking any pain medication, you can pretty much do what you wish. The pain after surgery usually lasts and is pretty much going away within 36 to 48 hours. Bowel function usually returns within 4 to 5 days for the most part. I tell patients that when they're hungry, that's a really good sign they can start to advance their diet as they wish. Until then, keep it pretty bland. Just like I wouldn't operate on your knee and have you run the Boston Marathon, I wouldn't have you do a major operation on your gallbladder or your colon and have you eat a chicken fried steak or something like that.
Ask our doctors on bestdocsnetwork.com.
My son was going through a transition of graduating from high school and entering a new chapter in his life. And so I think there was some anxiety on his part. There was some anxiety on my part. It was coming out in negative ways, and we had to identify what's going on. And we needed somebody, an outside person, to kind of help us mediate and facilitate through some of the feelings that were going on.
Irma and Quattro were great. I really enjoyed working with them. They were both very sweet, very bright, very interested in working in therapy. They initially came to see me because Quattro was moving along in his development. He was moving into young adulthood, moving off into college, and part of the conflict there was, what is his move into college and his developmental move into young adulthood mean in terms of the renegotiation of boundaries between mom and son, and then the renegotiation of roles between mom and son.
Dr. Hodges provided a great environment. He's a facilitator and a mediator, and that's what me and my mom needed in our relationship at the time.
The main change that I saw was a better understanding from each of them as to what their new role was going to be. They both came to a better understanding as to who they were, not only as individuals, but as a close mother and child.
Dr. Hodges gave us some really good guidance and encouragement, and through love and trust, we were able to get through some tough spots and have some success.
After seeing Dr. Hodges, it is just gave me and my mom a greater respect for each other as individuals, and just has taught us to learn and grow with each other. Dr. Hodges has helped me realize what progress is and how to obtain it.
Welcome. Today we're joined by Dr. Denton Cooley, a native Houstonian and the actual founder of the Texas Heart Institute. What a pleasure to be with you today, Dr. Cooley. Thank you for joining us.
Well, you're welcome, and thank you for visiting our institution.
Can you tell us a little background about how the Texas Heart Institute became an entity?
Well, it, I think, began in the mid-1950s when open heart surgery was first introduced in our Texas Medical Center. And before long, my program here at St. Luke's and Children's Hospital was probably the most prolific of all institutions in the country, including the Mayo Clinic, and Cleveland Clinic, and everything. And we had a simplified technique of open heart surgery and soon began a leadership position in this new field of cardiac surgery. Well, then I decided to create this institute in 1962. So it's been a little over 50 years ago.
What is your most vivid memory about the Texas Heart Institute, about any type of incredible learning that has been occurring here? What's your greatest memory?
Well, of course, our Heart Institute was created with two objectives, that is, research and education. So in each of those aspects of our history, I think there are certain exciting things that have happened.
And when the Texas Heart Institute first came into being, cardiothoracic surgery was high on the list of available procedures to be done for patients. Now we have the artificial heart and the LVADs. And so would you tell the audience about that?
Well, I think that it shows the evolution of cardiac surgery. First, we started off replacing just some of the components of the human heart. That is the valves and the great vessels and modifying the ventricles and that sort of thing. And then the big breakthrough came in 1968 when we did the first successful heart transplant to replace the entire organ. And that was really an exciting period that followed that. It was such a new concept.
Amazing, right?
Yeah.
And we have actual volunteers here at the hospital who have been survivors from cardiac transplant for about 20 years now.
Oh, yes. Our initial work in transplantation, we did, I think, about 15 or 20 heart transplants in that early era. But so many of these patients suffered from rejection of the tissues. But in the early 1980s, a new breakthrough came with the development of a drug called cyclosporin, which is still in use today and has made it possible for some patients to survive transplantation for 20 or 30 years. So it's a really big change.
Quite miraculous, and you are such a part of that endeavor, and we humbly thank you for everything you've done for the world population, actually.
Well, it's been a great satisfaction to me to see how this institution and our whole medical center has grown during my lifetime.
Thank you, and now we're taking you again all over the world with Best Docs Network, and we just wonder if you have something in these closing remarks, if you can tell our public something about the Texas Heart Institute that you would like them to take to heart.
Well, I think that we have done a great deal to reach our original objective of research and education. But at the same time, we've made many advances in just clinical medicine and surgery, and have enjoyed a leadership position in this new development now. It's sort of inspired the entire medical community around the world. And you can find large cardiac programs going in Europe and South America and elsewhere in North America. Just amazing to see how rapidly it's expanded.
Well, for all of us who have trained under your great leadership, we humbly thank you, and we give you great honor, Dr. Cooley. Thank you for being with us today.
Oh, thank you.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Coming up on the second half of today's show, ENT surgeon Dr. C.T. Nguyen talks about how he treats those with postnasal drip and deviated septums. Learn more about the outstanding medical facility Houston Northwest Medical Center. Cosmetic Dentist Dr. Guy Lewis talks about his philosophy and approach to practicing dentistry, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I had the four front teeth were very crooked. Two were going forward, two were going backward. I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me. So I did some research. I don't know if there's cosmetic dentists up there. I'm sure there are, but I just didn't investigate it. But I did investigate this one and thought, well, this looks like a good as any. And so I did some research, checked into it, and here we are.
Well, Ken had come from Cleveland, Ohio. So he sent me a lot of pictures and stuff before he came, and I knew I could help him out. And so he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put them on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps in the process because I live so far away. But very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works, I mean, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're gonna have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, oh, that's funny, something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family, my kids, I actually smile instead of, kind of half smile it. And they were always making fun of me for that. So very happy with the results. The staff is very professional. That they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, come in and experience it, see for yourself. It really can be very pleasant.
Request an appointment on bestdocsnetwork.com.
attention to detail is phenomenal, from the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
Eating eggs for breakfast not only tastes good, but they help to slim you down. Each egg you eat has 6 grams of protein, but only 72 calories.
High cholesterol is a major problem in this country as well as in many countries around the world. High cholesterol leads to atherosclerosis, blockage of arteries that affect many organs throughout our bodies. So how can we effectively treat high cholesterol? There are medications, but sometimes medications can cause multiple problems for patients, multiple side effects, muscle pain, weakness, breakdown of muscles, liver dysfunction, to name just a few. So we know that natural has always been the best, and we look for natural therapy with regard to cholesterol reduction. There is something that we use called Bio's Life Slim, which is a fiber product created at Stanford University about 20 years ago to treat high cholesterol in those patients who are intolerant to medications. It's been there for 20 years, but not many people know about it. We use it in our practice, and we've taught many doctors how to use this effectively to lower cholesterol. LDL is lowered by 30%, triglycerides lowered by about 50%. So ask your doctor about Bio's Life Slim. Look for it. It's an amazing therapy, and it will help you to change your life.
About 20 years ago, I started jogging and been quite an avid jogger during that 20-year time period. About 10 years ago, I tore my medial meniscus, and I had to have some surgery done on it, and went back into jogging. And then about 8 months ago, I started having trouble again with my medial meniscus.
Phil's a middle-aged, 50-ish age patient that was, playing some sports and twisted his knee, felt a pop, had a little bit of swelling, some medial-sided knee pain. So we evaluated him, we got an MRI. It showed that he had a meniscus tear. The meniscus is the structure between the thigh bone and the shin bone that provides cushion for our knees.
I went to Dr. Chris Wong. At that time, he put me into some rehab, and then we both decided that I needed some surgery done.
What we did was look inside of his knee, arthroscopically, making 2 little portholes, and then trimmed out the torn part so that it doesn't rub and cause him pain. Most things can be treated non-operatively, sprains, strains. However, things that need surgery are like large meniscus tears, loose bodies, people that have knees that are locking or getting stuck due to structures getting caught in there. And we can now, do surgery through 2 or 3 little bitty holes.
Going into the surgery, I think we're all nervous when we have a surgery done on us. That's just part of being human. But it went very smoothly. Dr. Wong and his surgical team, where I came in, visited with me shortly before the surgery. We went in. I was there about 3 hours, maybe 4. And out, they arranged to have physical therapy rehab machine that was put on the knee, and faithfully used that for about the next 4 weeks. And I've been on several recent trips where I've walked an incredible long ways and done some limited jogging, and it's worked out very well for me. Bottom line is the knee is better, significantly better, and within a few days I was back up and walking and doing quite well.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple courses of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.